the idea is to be able to present a treatment plan with 10 crowns in it in 30 seconds. If you can do that, then you're going to be able to do any other treatment plan. If we look at top of page 6, I've given you 2 examples which will cover a lot of ground. Fillings versus crowns. I've said it to patients so often that I don't have to even hardly engage my brain. We have 2 ways of fixing teeth. Any generalist, we have 2 ways of fixing teeth. We have fillings and we have crowns. We do fillings when we have lots of tooth left, enough to support the filling. When we don't have enough tooth left, then we have to do a crown. And in your case, because of the external cracking we're seeing in your teeth, there are 10 teeth that I'm concerned about. I have treatment planned all 10 for crowns. The good news is that some of them are worse than others. You can do the treatment right now, or you can spread it out over time. So was that 30 seconds? That is so much better than putting the x-rays on the patient's lap and saying, you see this filling? It's been leaking for decades. And then the whole description of the buildup, it's made out of a material called composite. That acts as a foundation for the tooth. Of course, it's very close to the nerve. Might need a root canal later. I'm not quite sure. We'll have to see how it feels. And the patient's eyes are rolling back in their head, and you haven't even gotten to the second tooth yet. So the idea for doctors is to learn to condense your presentation way, way down. If you happen to have an analytical in front of you, and maybe you just misjudged that. You put them in driver and they were analytical, and they start asking you questions. They start saying, well, Dr. Acree, what kind of porcelain is that going to be in that crown? You're right at home. You can just run with that all day. You can talk about precision attachments and bone grafting and all kinds of stuff, and you're just as happy as you could be, right? Yeah. And so you don't have to learn anything to do that, but unless the patient asks you, don't go there. Only go there if the patient asks you. The patient where you really want to avoid the technical stuff are the expressives. The high I individuals, they tend to be non-technically oriented. Remember, that's your more flamboyant person who's more extroverted. They want to look at before and after pictures. They want to know how people felt after they had the work done. They've already decided that they trust you and that you're the dentist to do the work, and once they've made the decision, you don't want to start confusing them with those details.